All right. Welcome, friends, colleagues, students, citizens of the world. It's your boy, Leroy Horton, back with another episode of the Teach Me Implant podcast. And I am excited today because I have someone on the show who I've been interacting with a little bit lately, who has been putting out some very insightful content, I would say, that stimulates a lot of conversation, especially on TikTok. I have someone you may know as Tooth Jim, but she goes by Miss Jasmine Cribs, doing it big down there is it the LA area?
I'm in San Diego, California.
San Diego. All right, Jasmine, how are you doing?
I'm great. Thank you so much for having me. I appreciate this.
No, thank you for coming on. I'm always interested in having conversations with people that I see that are doing well in their professional space and they've developed a platform to hold conversations, share thoughts and ideas. And I think right now more than ever, because I don't know if you've been witness to it like I've been witness to it, but there's a war going on between hygiene and dentistry.
Yes, I
So
agree. I agree.
yes. So real briefly, tell us your story. You're a hygie down in the San Diego area. How long you been practicing? How'd you get into it? All that good stuff.
Okay. I actually started off as an assistant.
Okay.
So when I went to assisting school, graduated there, went into an office, general practice for about 4 or 5 years. And then I decided to go to hygiene school. So
Okay.
then I graduated hygiene school in 2019. So I've been practicing hygiene just itself since then. In 2021, I got my alternative practice license, and that's where I'm at right now with that. So it's been a
Okay. So
journey.
so for people that don't understand what alternative practice license means, what is that?
So it's basically allowing the hygienist to practice independently
Mm,
and more so to be able to open her own practice and practice solo in there without the supervision of a dentist. Now,
okay.
you're still in collaboration with the dentist to be able to refer out patients if needed,
Right.
but you can pretty much just practice solo. Benefits, I would say, of still working in the traditional setting is that it allows you to legally work by yourself in the office
Mm-hmm.
without the dentist having to be present. So that just
Okay.
kind of takes us back to one delivering local anesthesia because that's
Mm,
a big one. Hygienists should not be delivering it without the supervision of a dentist. So with that license, you can do that within that practice.
okay. So you're able to do stuff that otherwise you would need maybe not direct supervision where they're in the room, but they have to be on the premises, right?
Correct. Yeah.
This allows the doctor to not be on the premises. And do you have your own brick and mortar clinic that you work out of?
I do not. No.
Okay. And so you're in a space where there is traditionally already a doctor or doctors, but you're working independently. Are you like renting space? What's the logistics of all that?
So right now it's just like a traditional setting.
Okay.
I'm actually in transition into my own clinic.
Hmm.
There's just something still underway as it goes with opening a business. So that would be the transition is I will be in my own clinic by
Okay.
myself, referring to the dentist. But as at this moment, I am within the office. So the only thing I really do now within that office is be able to work on a day where maybe the office is going to close
Mm,
for whatever the case may be. Sometimes doctors don't come in, there's not associates, whatever the case may be.
right.
So right now, that's the only thing that I can really use out of that license is to be able to give anesthesia when no one is present and to work on a closed day, pretty much just hygiene by myself.
Now, how does that work with diagnosing in California? So they allow you to have the alternative practice. Are you allowed to diagnose as well, or do you still have to have a doctor associated for diagnosis of like a certain stage and grade for periodontal disease, let's say?
Yes. So that's a great question because I think that's another thing that's underway of
Hmm.
trying to get hygienists to just diagnose. But no, we still cannot diagnose. So what happens is the patient would need to have a treatment plan
Okay.
already. Yeah, already be diagnosed with whatever the plan would be. And then they could then go to an independent practice of a hygienist and get
Right.
their services there. Also, you can see a patient for up to about 18 months without them having to see their dentist. So within, yeah, by that 18-month mark, they would have to have seen their dentist in order to continue treatment with you.
Okay. So let's say patient comes to me and they have a treatment plan. And in most traditional offices, we have in-house hygienists, right? Just like you
Mhm.
are working out of a dental office. What does it look like? Why would a patient say, okay, great, I got the treatment plan, but I don't want to get the cleaning done here. I want to go to Miss Cribs down the street and get my cleaning there. Are hygienists going to be charging less? Are you guys going to be in network with insurances? Are you billing different? What does that part look like?
So it would be different per hygienist, right?
Mhm.
And I believe there's only limited insurances that are actually going to contract with a alternative practice hygienist outside of, say, Medi-Cal, right? But
Right.
most of it would be fee for service. But at the same time, that fee for service typically is going to be a lot cheaper than a traditional setting.
Okay.
So I would say for patient wise, their main reasoning would be finances.
Okay. So even if like with my insurance, Preventive is covered at 100%, right?
Mhm.
Now, if I come to you and it's fee for service, how do you beat that? That's one of the intricacies of even just owning an office is dealing with like the myriad of different insurances and
Yeah.
all their caveats. Have you guys thought about how do you compete in that type of model with the insurances where Preventive is at 100%?
There's no way to really get around the insurance aspect of it, right? But outside of just the insurance, it plays a major part of having more time with that hygienist. In a traditional setting, it is very fast paced, I would say sometimes. So you don't get the full scope of the treatment. Some patients, right? Some are okay being in and out, some want more time
Right.
depending on the office and what insurance they carry. There's PPO offices, HMO offices, Medi-Cal, Denti-Cal offices. The experience is different across
Right.
all of those.
Right.
And then there's the independent practice ones. So maybe more flexibility, right? Because they're independent. They can come see you at 9 p.m. if they wanted, something of that sort. So
You doing midnight dentistry? Is that
I'm
what you're
not,
talking?
but I'm not, but it's an option. You know what I
Yeah.
mean? Because it would be my own schedule. Maybe that's my only patient that day at 9 p.m. I don't know.
Right.
But something of that sort. You can't really compete with what the insurance is going to cover, also because they don't all contract with hygienist. So then that's another thing. So I'm thinking they're more going to go for the experience
Mm,
of that private independent cleaning
okay.
with them. Yeah.
And I'll be honest with you, the older I get, the more I value time. I mean, I've had a couple medical appointments recently and it's like doctor pops in, "Hey, how you doing? Great to see you. Nothing wrong. Good. Okay." Bounce, right? Even
Hmm.
now like it used to be the nurse would spend a lot of time with you and ask you your health history. Everything is automated. So you do everything and it's usually a medical assistant now that just takes your blood pressure and walks out. It was like the most impersonal
Correct.
experience.
Yeah.
And I would pay more, and I'm obviously privileged enough to be able to pay more, but I would pay more to feel like I'm getting an experience, right?
Correct.
But that being said, kudos to you for taking on this challenge. My question as a former owner, although I enjoyed my fair amount of my time in ownership, why would you want the headache of managing? You have to have an office manager, you got to have a assistant or sterilization tech or staff, however it looks in the new model. Why would you want that headache? Is it just to have the freedom and ownership? Do you have specific vision that you're trying to create with it?
There's definitely a vision behind it, but I would say in reasoning, the same reason anyone wants to own their own business, right? Now, when we're talking an independent hygiene, this is a one operatory office.
Mm,
This is not multiple operatories, multiple assistants, multiple front staff. And in a sense, I can kind of take on each position. Like I say, the traditional setting is like a 1 hour cleaning. If I wanted to make a 3 hour appointment, I have sufficient time to do A through Z in all of those areas myself, right? But
right.
you don't have to hire the full on staff. It is just a business, but it's a lot smaller of a business.
I
So then
see.
you work your way up. But the vision behind it, and more so it's for accessibility. So a lot of alternative practice hygienists, they typically go out onto public health settings or go to maybe the elderly homes, people with special needs homes, stuff like that. More mobile, right? But if I have the actual clinic, it opens up the accessibility because I can't tell you how many times people have denied a deep cleaning and just don't get it. And
Mhm.
it's like, well, if it was offered for half the price or cheaper, they probably would get it. So that's
Okay.
behind that. But the idea is that I want every hygienist to grow independently.
Right.
It takes me back a lot to just having no autonomy in the office, right? In a
Mhm.
traditional setting. So it's hard to try to just, you need to do all this for preventive care because that's the focus and you don't have the time to do it all. So the vision more so in the future is to create the brand, Tooth Gym brand. It'll be maybe just its own clinic and then have multiple operatories, and other alternative practice hygienists will now kind of create their own space, right, in between there.
Right.
So,
So one of the difficulties of ownership with hygiene for me was if I really wanted hygiene to be super profitable, you had to run a tight schedule, right? I was
mhm,
never a fan of that because A, the hygienists were never happy having 45-minute or just hour blocks for everybody. And
mhm,
I didn't think that, you can't always do a good job in an hour when you got to do, health history, x-rays, perio charting, and the cleaning, let alone whether it's a pair of maintenance or
right,
SRPs. So what I ended up doing was just telling my hygienist, you build your own schedule.
mhm,
For that particular patient, you feel you need an hour and a half, you need 2 hours, for whatever, you build your own schedule and focus on health. When that happened, yeah, we were a little less profitable from the hygiene side, but I felt better about it. But I know offices where when I go in now, especially that I'm doing traveling perio work, I'm seeing this old model of 1 hour block, you got to do everything. And I'm going in to do like perio consults after the cleaning, and I'm seeing calculus left behind, staining left behind. And when I talk to the hygienist, they're like, "Yeah, I just don't have the time. I'm sorry." And in my
mhm,
head, I'm just like, "Well, I know I got the clout. If I have a surgery and my surgery runs long, I don't like half do my surgery and be like, oh, I just ran out of time,
right,
right?"
right,
And so I do feel like you guys having, maybe it will take you owning your own business to have the autonomy to build that schedule.
mhm,
My question would be, with our American model of medicine and reimbursement, how can you pay the bills, maybe charging half the price for SRPs and giving yourself the extra time that you would need, that we all agree you do need to do a good job? I
mhm.
feel like you're hamstrung by the insurance industry and the payment industry. Have you thought about how that works? Because you do got to pay the light bill at the end of the
You
day, you know?
you do, and it depends, on the area, you
Hmm.
know? You have to do your research, your market research, like, what's going on in that area, and are these people going to be able to afford that anyways? Now, outside of just the hygiene services, there's so many other services that you can offer, right?
Right.
We're talking cosmetic, like teeth whitening. People want tooth gems. Like, there's so many things outside of that that you can still offer if you needed
Mhm.
to make money, say, some other way, right? But you
Right.
are going to make your basic income to cover your overhead.
Right.
So, and also, you're still working a full time schedule, but it's just your own practice now. And it depends. You can either maybe want to rent a suite within a salon sort of a deal, or you can have, like you were saying, a brick and mortar and do it that way. So the
Mhm.
cost is different for everyone. You just have to break down your expenses. You're kind of planning ahead, anticipating what you're going to have to spend and what you need to charge.
Right.
But that's the thing. Even if I have to charge a certain amount in my area, I would say it's still cheaper than what's out there.
Right.
So you're still gonna meet, you know what I mean, your overhead at the end.
So, and do you guys have Delta Dental down in California? You guys got Delta Dental,
We
right?
do.
Okay. We've been entrenched in this huge fight with Delta Dental up here in the Northwest because of low reimbursement rates. So one of the issues a lot of doctors have is, let's say Delta Dental pays you $79, $89 for the prophy. Well, up here, and I think you kind of seen me make comments online. Out here in Seattle, our hygienists are making 85 to $100 an hour, easy,
Mhm.
right? And so it's really hard to have the hygiene schedule be very profitable unless you start cutting corners, right? Small blocks of time, accelerated schedule. What type of challenges do you foresee, or have you done the calculations of like, all right, for my cash patients, this is how much I'll probably, you don't have to tell me like exact prices. I don't want anyone coming at you with this online. But like you said, it's
Yeah.
$59. But like, what's the price range realistically that you can be able to service at a better price and still pay the bills, like rent and chair time?
I'll give you an example of a couple of alternative practices that are already in place, right? And what those fees look like.
Mhm.
So, when you have, say, new patients or whatever it is, whether it's going to be elderly, special needs, those fall a little different because you're considering the commute as well,
Mhm.
having cover overhead of like a facility, right? But I would say, even if it's just going to be, say, a 3 hour block and you want to charge $300 for that block. Mind you, this is once every 6 months, right? If we're talking about a pro fee, something like that. But there's so much more that comes within that appointment, and everyone is different. Everyone, whatever they incorporate, that fee is going to include everything, right? 200, 300, whatever people want to charge. The x-rays if they're needed, fluoride if it's needed, or any extra therapy, I would say, if it's needed. Some people have it already included. There's not going to be anything more. It's not going to be anything less. Whatever you need is going to come out of that 300. Plus, there's also plans, like in-house plans. A lot of people offer those, and those are very beneficial too, whether it's monthly or you're just paying for the year, you're covered. And now you're covered for 3 to 4 cleanings, not just 2, right? Something like that. So I would say that's everybody's price range is different and they break it down differently. But I would say that's probably the average. But if we're even talking, I'm just going to say San Diego prices, right? Even from people commenting, deep cleanings are well over $1,000, almost $2,000. And there's all the little adjunct services attached to those things, right? So that's another thing to consider. Even within my area, fees are going to be at least half that, and that's a major difference. So not everyone has insurance. And as we know, insurance is insurance, and they don't care about people's health. So more people are like, well, I don't need dental insurance. So they're going to have to pay for it anyways out of pocket. And they're upset that their copay is still in the thousands after insurance.
Yeah.
That's another thing, unless not even then actually, unless you need a bunch of work done, the insurance, you're paying more on your premium than just paying for 2 cleanings a year out of pocket, right? So.
No, listen, I want this to work. When I was a general dentist, I probably would have had different views because I was in a camp, right? I was like, all these hygienists, blah, blah. Now that I've been a periodontist, I'm traveling, I'm seeing what a lot of other general dentists did. I often just assumed other general dentists operated like I did. And I gave my hygienist a lot of autonomy. I see a lot of scary stuff out there. A lot of neglected care, a lot of improper sequencing, right? Patients need SRPs. They don't want to do it. They just want to do the aesthetic stuff. Dentist is like, okay, as opposed to like proper sequencing of care. And I want to share a graphic with you just to highlight how important I feel like this conversation is and your autonomy is because of this. Are you able to see this here?
Yes.
All right. So we got a series of studies by Becker basically showing if you get perio treatment and you're maintained over long term, you lose 0.1 tooth a year or up to. If you're untreated, you lose 3 times that amount, right? And this other study here in actually the International Journal of Dental Hygiene, where getting your cleanings on a regular basis reduces your implant failure rate by 90%. Okay. Now, that is to say, if I were to be looking at you, let's say, you were, my sister, and I'm trying to convince you the importance of your cleanings and your maintenance, proper cleanings. I would say, listen, if you get your cleanings, there's a good chance over the next 20 years you won't lose any teeth. Or if you are, it's going to be maybe 1 to 2 because it's 0.1 tooth a year. That means in 10 years, maybe you lose 1. But if you're not regular with your cleanings, you could be losing up to 6 teeth in a 20-year period. That's a huge difference. When we start thinking, okay, I'll lose 1 tooth, 6 teeth? That's more than just the one side tooth everybody be missing sometimes, right?
And it's
or if you have implants, a lot of people have implants now. Like you can reduce your failure rate by 90% long term. And that was a longitudinal study over 17 years. It's by something as easy as getting your cleanings. And so that's why I feel like what you're doing or what your vision is very important, because these general dentists out there aren't respecting the hygiene profession, is my opinion, nor the foundational nature of dental hygiene. Everything else, the success of everything else depends on what Jasmine Cribs is able to do, what you give her the time to do in those appointments, right? What does that conversation look like when you're talking to patients that, regardless of whether it's insurance copay or private pay, how do you convince a patient the importance of that hygiene appointment on a regular basis?
In detail, how you were saying, I bring up as far as on natural teeth to implant teeth, and not all implants are single implants. We're talking about all, I don't know what you'd call them in Washington, but like all on 4 cases, all on X, that are supporting the entire thing. So, or they're supporting a 6-unit bridge, something like that, right? So then you lose one, you're going to lose the whole thing and have to replace that again. So when I'm talking to them, I need the time to build that rapport for them to even listen to me. some people, I mean, they're kind, but they just don't want to hear it sometimes.
Mm,
So I go into the importance of that and try to keep them on whatever my recall maintenance is, right? I recommend every 3 months. You want to say every 6? Okay. But I'm going to make sure that I explain to you how you were just saying the science behind everything. The more frequent that you do this, because this is my recommendation on what I'm observing right here for your health, everyone is different, is just explaining to them, I mean, in detail about ligament attachment, about these pocket depths, about what's going on under them, showing them visuals and playing videos for them, whatever the case is, and explaining. Like now that you showed me that study, that I can even bring that up.
right.
Anything new that I hear of, I'm going to bring it up because the times are changing and I need to be ahead and I need to let them know as well because some are older patients. They don't
Mhm.
really care. Younger ones, they're more hip and they understand the new stuff going on. So really, it just comes down to spending the time for me to be able to properly explain all of this and show hands-on things that are happening. Intraoral photos that I'm taking, right? Let me bring up the gum measurements. This is the comparison from last time. Even 1 millimeter, I'm concerned about a 1 millimeter difference,
Mhm.
right? Whether it's up or whether it's down. Like I want them to go down and then we just kind of explain that. But really it comes down to having that time to explain it to them,
Right.
you know, and really connect with them. Not like, oh, I got to hurry up. Oh, I got to get my exam in. And, you know, because ultimately the hygienists are the ones that are going in detail about those things, which is another thing. We're actually very educated on the restorative side,
Mhm.
not just the preventive side. So we talk about these things. And I even compare things like, well, this used to be a filling, but now it turned into this. The next step, you're going to lose it.
Okay.
So,
You know, that's music to my ears because I talk to a lot of providers that they're just, hey, this is my job, right? If patients don't want it, they don't want it. I'm not going to spend any extra time or
mhm,
effort. So I'm really happy to hear that that's your mindset, right? But something that you said, I want to jump on. You said times are changing. And a little preamble to this is prior to last year, they were, especially here in Washington, trying to pass a resolution to allow assistants to do supragingival scaling only. And it was in the vein of, well, they'll be able to assist hygienists and they'll be able to assist the doctors by speeding up the process, and then hygienists can come in on the back end and do the subgingival scaling and finish out the appointment and so forth. Well, this year on our Washington State Dental Association resolution, there was a lot of added extra language. They want assistants to be able to probe, to do the supragingival scaling, to be able to give local anesthetic, right?
uh,
And a slew of other duties, all under the auspice of this oral preventive assistant. And I was probably one of the only one. I put a resolution to strike that down, and it got voted out like 58 to right. So most general dentists did not agree with me protecting the scope of practice of hygiene, right? Because you guys
right.
have 2 to 3 years of intensive, specific
Yeah.
training for this stuff. But this is passing in state after state. A couple states on the East Coast. I saw Arizona passed it, Oregon passed it. How do you feel about this extended scope of an assistant who, with just a little extra training, now all of a sudden they're pretty much doing your job that you are licensed to do? Like there's a reason you are licensed because your
Right.
education is extensive. What does that feel like as a hygienist hearing that that's where the industry is going?
So I personally, because I didn't know how much they were allowing them to do, and maybe it is state by state.
Mm-hmm.
So, but as times are changing, that's very new. And a lot of dentists are not on board with that. So I'm not afraid of it at all, but it comes down to the training behind it.
Mm-hmm.
And that's the same experience patients are going to get when they're just getting quick, fast, in a hurry cleanings. And they're going to feel that. The OPs are not going to have that extensive training background on what's actually going on beneath within the body, the connection to the entire systemic health, and things of that nature. They're not going to be able to answer questions. How are you going to have a full on conversation and actually prevent this? All you're doing is basically like a prophy. I mean, in a sense, local anesthesia, I didn't even know that was
Mm-hmm.
that was going to be a thing.
Yes.
I'm kind of concerned about that. You know, you need to know where to insert.
Yeah.
I don't know how extensive that training is going to be. And are they not going to need a license? So they don't need, that's questionable. Or they don't need CE courses?
Yeah.
Yeah, I'm concerned for the patients. I'm not concerned for myself. I'm concerned, yeah, concerned for the patients. So that's a big problem. And I honestly think it's that disconnect between dentist and hygienist.
Mm-hmm.
Just trying to get it get it done. What, insurance, how you were saying insurance is paying under $100, and the OPAs are going to get paid what? Probably half of what hygienists get paid.
Mm-hmm.
And I don't know. I mean, it's a big concern for the patients, I would say.
It is. And it's one of those situations where we're fighting each other, dentists versus hygienists and so forth, and hygienists versus assistants.
Mm-hmm.
And a lot of that is propagated by low reimbursements rates by the insurance companies. And so it's another example of people at the top creating policy, and then we're just like crabs in a barrel fighting for scraps amongst ourselves, right? But I'm glad someone on the forefront like yourself, with everything that you've expressed, is out there, educating patients and looking for new and innovative ways to provide the care that patients should get. And this new OPA thing, I'm hoping it doesn't pass here, because there's just so many, and I'll give you an example. And this isn't a knock on assistants, this is a knock on hygienists or doctors, but I will punch across, because a lot of my doctors are doing some horrible things. I'm going to read you a text that a former assistant of mine that worked for me for years, she sent me, and she goes, "Doc, I have a question. What are the consequences if a dental assistant does a pro fee or SRP like the hygienist?" My response is, "Well, that's illegal. You can't do that." She goes, "I'm not sure what I have to do. My doctor makes me and my coworker do that. He numbs the patient and he makes us do the rest." And so I tell her, "Well, that's illegal. You got to report him or her to the board. They can lose their license. You can get in trouble as well." And I think that was my main concern, is I don't trust that every doctor out there, and you might say, okay, well, maybe that's just a small percentage. Being that I've traveled to many offices, and because you've spent some time temping in your career as well, you've seen some scary offices.
Yep. Yeah.
And what's a good percentage? If it's 0.5% of offices do shady stuff, we might say, okay, eventually the market will weed them out. I would argue at least 10 to 15% of offices, if not more, are doing subpar protocols, treatments. I mean, where would you put that percentage in your
I'm putting
experience?
it above 50, to be honest.
Okay, tell me
Yeah.
more.
I've been around as a
Yeah.
hygienist, so, especially with temping,
Mm-hmm.
especially temping. Yeah, everything is questionable to me. I'm like, wait a minute. What? Okay, I won't be coming back here. It's just like, what am I going to do? Report everybody? Like, let me just move on, and maybe that was just today, but I think the percentage is higher on every end. And honestly, I would say I think dentists are supporting the OPAs because they're already doing what you just mentioned, having the assistants do the cleanings. And they're thinking like, oh, go do this. Now it's legal. You know what I mean? To cover their end, because we all know it's a problem. We all know that assistants are doing cleanings. So, I've had patients tell me, oh, such and such doesn't do the cleanings anymore. And I'm like, I don't know. I don't know. Maybe such is busy knowing that's an assistant,
Right.
and I don't like that. So I think that's probably where the whole OPA thing came from. But yeah, it's happening out there.
It's happening, and I often hear it justified as, oh, well, it's just the patients that are healthy and they only have supragingival calculus. And in my head, I'm like, I've never met a patient who didn't have some calculus subgingival. And even when you have supragingival calculus, as part of a cleaning, you still do subgingival instrumentation.
Yeah.
There's a 3 millimeter sulcus on a healthy patient. You still need to clean under. You don't
Yeah.
avoid the sulcus, right? So you can't do a cleaning like that.
Yeah.
But that being said, I do want to play a video of you, of which that caught my attention.
I have a question for ortho offices. Why don't you have a hygienist on deck? Like, we all know that with ortho, patients literally get gingivitis like instantly. So I don't understand why there's not a hygienist in the office there for those cleanings before you band. And I don't mean just polish the little area where you're going to place the bracket, but to do the thorough cleaning before you even start. And also throughout treatment. Patients are probably going once a month or whatever the case. By that third month, they have a pretty generous amount of plaque there. So I guess I just don't understand why the hygiene is not stressed, specifically in an ortho office, when those patients experience the most. I also feel like a lot of things are not talked about. Okay, I have a question.
Okay, so I love that idea. Okay, before I say anything to critique it, right? I want
Yeah.
I promise you, I love that idea. I've been through braces. My kids have been through braces. I saw, I don't know how many hundreds, if not 1,000 plus patients that were going through traditional braces. And yes, if brushing can be difficult on its own, now add brackets and wires and bands and tads and all that, right? When I heard that, my thought was, yo, that would be awesome. However, would you charge for a prophy or some type of procedure being done separately? Would that impede on the general dentist or the referring office's 2 cleanings a year? And that's one thing, especially as a specialist now, I always have to be mindful of. Even in my perio patients where I do initial therapy, I might want to do the 3-month cleanings for the first year in my office and then graduate them to like an alternating schedule or whatever. But there's a lot of general dentists where they will stop referring to you if they think you're taking production from them. Have you thought about how that would work logistically? Because I would want that to work because it only makes sense. Because there's some yuck mouth teenage braces kids and adult braces kids walking around, So
Yep.
tell me more about that. Have you fleshed that idea out?
Not thoroughly. That was just a thought I had. Um, then again, I just put it out there because I want to know, right?
Mm.
And the feedback was, yeah, it seemed like it was going to be an issue as far as general offices no longer referring. But if I had to just kind of think about that, while patients are in ortho, really they should be getting their cleanings once every 3 months, right? I don't know what insurance people have,
Yes.
but
Say
yeah,
yes.
what
Every
they
three
have,
months.
you could do, I don't know, do 2 here, do 2 at the other one, right?
Mhm.
If you want to pair. Or incorporate it into the ortho fee. Braces are not cheap. I don't know, tag on another $500 or something.
Mhm.
Make it work. Then you don't have to think about insurance and what's happening. And these people are in ortho. They're going to be out of ortho at some point and
Mhm.
then beyond and go to your office. They're not going to just, stay here all the time in brackets all the time. So I don't know. I didn't think about that end. I'm just thinking like we are creating issues for these children, for these adults. And I feel like in ortho offices, they're not stressing the importance of the hygiene. So they come now to a general office. And I've been in offices where the general does brackets in the
Mhm.
same office, so it's easier, right? We don't have that issue. But yes, the ones where they're two separate,
Mhm.
because I've seen them do a polish, right? But that's just like around the bracket, basically. So I feel like we're not doing the patients any justice with that. But have I thought about the business aspect of it? No,
Yeah.
because I didn't really care about that part. But I know it has to play. We have to be able to figure it out. I don't know. What do you think? Is there a way to figure that out?
I've thought about this since you dropped that video. And I'm not even just saying I'm not buttering you up because you're on the show right now.
Yeah.
Logistically, a lot of orthodontists do take insurance. And so that fee is fixed. You can't roll it over into your fee as if you're a fee for service, right?
Okay.
Even if you were fee for service and you roll it into your fee, you're still competing with Joe Schmo down the street, who for the most part, you're probably similar, but now you raise your price another $500. Patients price shop. They're like, oh, well, it's $500 cheaper at this office, or that's a potential complication I see. Hell, it's hard to get them to pay for more than 2 cleanings a year.
Yeah.
Even on a patient with a history of perio, sometimes you got to fight to get, with narratives and pictures, especially for a young teenager who probably needs it most, because the amount of teenagers I've seen go through brackets, I've only had one orthodontist. His name is Dr. Kashner out here, an amazing orthodontist. He would see patients if they had poor oral hygiene. He would refer them back to me with a note saying, we're pausing ortho, we're taking off the wires, and we will continue when the patient's oral hygiene gets better.
Yeah.
And then usually that's enough to scare the parents into forcing the teenager to start brushing their teeth so they can
Hmm.
finish the orthodontics, right?
I love that.
I would love to be able to have a clause in insurances that say that, hey, while you're in orthodontics, while you're in controlled inflammation, because that's how orthodontics, the biology of how teeth move, it's inflammation, more frequent cleanings are called for because we are inducing inflammation. I would love it. I have not come up with one way in which that will work. Not in this American system. And I know I keep saying American, but it's the way we do things here is very uniquely driven and controlled by a for-profit insurance company.
Yeah. Yeah.
I don't know. And yeah, I would love to see that happen. So maybe we can keep putting our brains together and come up with something.
No, absolutely.
Yeah,
I know there's a lot of big problems that, we try to get to, but I mean, even if it's not now, I think that's a great idea that they should incorporate that during ortho treatment, active ortho.
right.
Even if they want to start with putting an age limit on it, I don't care. Okay, under 21, let's say, right?
Right.
And over 21, okay, because you're an adult, you should be brushing your teeth.
Right.
So otherwise, I mean, I've also made a video about when parents put their children in ortho, they don't realize that they need to help. But then again, they're not educated.
Mm,
So they're thinking, well, my kid's 14, they brush their own teeth. Why would I need to help them now?
right.
Until they come and then they see the hygienist and I'm saying this and that. Oh, okay. Okay.
Yeah.
You know, they need to become responsible as well for that. But because we know they're not, I feel like a hygienist should be. And I've seen some hygienists say that they're in an ortho office, but I think it's still general and ortho.
Mm,
So I don't think it's just like a general or an ortho practice hiring a hygienist. I'm not
right.
sure. Yeah.
Well, what we see a lot now, obviously, with corporate dentistry taking over, you got all the specialists in house, right?
Hmm.
You see a lot of private practices emulating that. So they will contract with specialists to come in once a month, twice a month.
Hmm.
So again, everything is
Yeah.
in house. One of the last questions I have for you is the intrusion of the corporate world into the dental industry. How has that affected the lay of the land for you as a hygienist? Do you see that it's been helpful, hurtful? Has it fostered the temp industry more because now there's more offices that are looking for temps versus full-time hygienists? What's corporate dentistry done to a hygienist like yourself?
I think it's taken away
Mm,
the purpose of what we're doing. We go to school for so long. Mind you, in school you have 3 hours per patient.
hmm.
So it's definitely, I would say they don't train you for the real world in that aspect, but it's taken a toll. Hygienists typically are not even physically able to practice that long because it's very quantity over quality
Hmm.
in a corporate world. And they also pay a lot lower. I would say they have benefits. When you're working private, you probably don't have benefits. So it does have its pros and cons, but personally, I don't see very many hygienists that would want to be in a corporate setting for many reasons. But then again, it's because we care for the patients, right? This is all about prevention. And we're not really preventing, I feel like, in corporate as well as we even would in private. And sometimes I feel like even in private, we're not.
Right.
So
Right.
yeah,
Well,
temp wise, I know a lot of people, and it's funny because people are asking like, "Oh, why do hygienists want a temp?" But it's like, do you wonder why so many people are looking for hygienists and they don't stay in the office? You're
right.
looking for people for a reason.
Yeah.
Oh,
And maybe I was just a bad business person because I hear stuff like that all the time. And in my head, I'm like, damn, we provided benefits for our hygienists, right? Our hygienists got medical. We did in-house dental. They got PTO. They got holiday pay. But I see so many of my colleagues didn't provide that for hygiene, right? And we had a fair amount of hygienists between my two practices that were there for years, and maybe that's why, right?
yeah,
On top of paying $80+ an hour like we do
right.
in the Seattle area. But I truly, like I said, I've always felt even before I went to perio that the periodontium is foundational to everything else.
It is.
Nothing else is going to have the longevity that we wanted to have unless there's a good hygiene regimen and a good solid hygienist doing those cleanings. And
Hmm.
unfortunately, one of the most frequent complaints I've gotten from patients about doctors, for the most part, isn't like the normal, I got a feeling now my tooth hurts. It's often if we didn't have a hygienist or the hygienist was on vacation and we had doctors covering hygiene, it was associates doing these little 2-minute cleanings. And then the patient would come out like, yeah, I don't want that doctor to do my cleaning again. Like, they try to be nice. Like, I'm sure he did a good job, but it was like
Yeah.
2 minutes. I've always respected the hygiene arm of dentistry because it's so foundational. I've had you on here for about 40 minutes. I absolutely appreciate your time. I'm hoping I can bring you
Like,
back, especially as you have updates on your business ventures and your growth. Is there any parting message that you want me and my listeners to have from someone that's in your unique position in a market like California that's transitioning with some innovative ideas to hopefully positively transform the industry?
Yeah, I would say if we as hygienists and dentists can just collaborate as we should be collaborating, I think it takes it a lot further for business wise and patient care, and patients returning and retaining your patients in that office. Even so, you don't want to burn bridges with people. You know what I mean? You respect each other. And in a world where even just OPAs are coming along and hygienists are becoming independent and moving along, they still need to refer to people. So you still need referrals. Otherwise, you'll probably see people coming to get their quote, to get their treatment plan, and then not come back
Right.
you know what I mean? But not every hygienist is there. It's definitely a newer thing. But if we can just kind of collaborate while we are still in traditional settings, I mean, I think that's best. We have two different views, one restorative, one preventive. But I mean, also, I don't know if it's like prevention. If they're not doing so well, then they need restorative work
Right.
eventually.
Right. Right.
But that's
And an
crazy.
ounce of prevention is worth a pound of cure, and that's so true across all aspects of medicine, right?
Yeah.
The more you prevent, you're going to save money, you're going to save time, you're going to save teeth, you're going to save
Mm.
gums, you're going to save a whole lot. And I think a lot of patients don't realize that until they get older. And there's a
Yeah.
lot of regret on older patients when they do got to lose teeth or do have to wear dentures or
Mm.
pay an arm and a leg for implants. And I'm of the ilk of I am always going to try and save a natural tooth when reasonably possible versus putting titanium in.
Right.
And I think the industry has gone, it's had titanium fever for way too long. I want us to focus on implants so we don't, or on preventive so we can
Right.
avoid other stuff. Well, Miss Cribs, Jasmine Cribs, RDH of San Diego, thank you so much for giving me your time. I appreciate you. I look forward to seeing what you're doing in the future. I absolutely want to have you back and get updates and opinions as new things happen in our industry. And to anyone that's listening to this episode, my parting words: keep reading, keep listening, keep learning, and we'll talk to you soon.
Thank you so much. Appreciate you.